get started. So first of all, the minutes of the last meeting. Has everybody that was at the last meeting read them? And any concerns, questions about them? Okay, so we'll approve the last minutes. Thank you. So apologies for absence. We have apologies from Councillor Link, Councillor Friedman, Councillor Cox, Edith Glatter and Kevin Minier. That's all the apologies for this evening.
Sorry, Chair, I mentioned Councillor Sharon Wilkie sent her apologies as well, but through me.
Okay.
Yeah.
Thank you. So declarations of interest. As usual, I'll make a declaration that I work for the Herts and West Essex Integrated Care Board and Hertfordshire Community NHS Trust. So I'm a designated safeguarding professional, community nurse and health visitor. Any other declarations of interest, please?
Yeah, still a paramedic with the London Ambulance Service.
Okay, thank you.
I'm a member of Dacorum Hospital Action Group and the New Hospital Campaign.
Thank you.
I might declare as domestic violence is on the agenda, that I work for the Crown Prosecution Service and deal with that almost daily.
Thank you. So we'll move on to public participation. There's been no questions submitted, and there's no members of the public here. So there's no public participation today. Agenda item 5, ward issues. I'll take it as read that you've read the papers highlighting the ward issues. I would encourage if for future, if you can provide updates from within your ward, that I think would be really useful to get a picture across the borough of any health issues affecting wards, so we can start to collect the information and potentially do pieces of work in the future. So before the meetings, Jenny will send out a reminder to all the councillors to encourage you to just provide a summary, maybe a small paragraph, couple of lines, whatever suits, of issues within your wards around health, because I think that's quite beneficial for us all to be aware what's happening in other wards as well, because there might be similar themes. Okay, item 6 is West Herts Hospital Trust. They're not here and we haven't heard from them, unless any of the officers have heard. No. And the same with item 7, Hertfordshire and West Essex Integrated Care Board. They're not here and we've also not heard from them either. But we will follow that up for the next meeting, because I think it is useful to have their attendance. So moving on to item 8, the Health Inequalities and Healthy Hub update. Were you going to speak to that one, or are you happy that papers have been read?
I'm happy to take papers as read, but just by way of a brief introduction, this is 2 officers who are funded through Public Health at Herts County Council, were funded to March 2024. We've recently, a couple of months ago, had confirmation for a further year's funding. The work that is identified, the first 3 items in sections 2.2 to 2.5, are the 3 key projects that were agreed as part of that funding with Herts County Council for delivery. But you'll note from the report that the Health and Equalities Officer is also undertaking quite a lot of additional projects and work alongside that, and working with Healthy Hub. And just for members, one of the other projects that we are working on is very much with local MPs and with the ICB on joint health inequalities work. And at the next committee for the forward plan, I've, since I submitted that last list, confirmed that either or both of those GPs will come along and give a talk and their thoughts on how that work is, how it's working, and the work that we're undertaking as part of that joint health inequalities work.
Excellent, thank you. Any questions?
Can I ask a question? I worked with, because walking is a key thing with keeping fit and losing weight. And it's very much focused this on GP surgeries and I think Watford Football Club and Bowl. But a free thing to do that's very, very healthy is walk. And there is an Asian lady called Dr. Geeta Ludra, who runs events in the Chilterns at Ashridge, and it is about kind of culturally getting people out walking, because it's something that isn't really particularly done. So I really recommend her as a contact to help, and they're always free. Her walks are always free.
So we, thank you, Chair. So very much I'll pass it on to the Health and Inequalities Officer and raise it at the working group that you have with the GPs, because it very much would fall into the promotion of activities as part of that work. So we'll pick that up and we can perhaps discuss further when they come to the next meeting.
Thank you.
Thank you.
I'd like to thank Diane for the work that she's been doing, especially in regard to the report on the 9 to 11 living in Bennett's End. Really kind of key to what we're trying to do in Bennett's End in terms of our Bennett's End active group. And just to say that I did furnish the chair with information about the work that we're doing with the South Asian community, particularly Hertfordshire Asian Women's Association. We're working with Rushna Mia and also with Helen Rowe-Watton in terms of trying to break down barriers with South Asian females in particular in terms of getting active with physical exercise. And just to make you aware that we've got a female-only gym at Bennett's End, which is tremendously popular with South Asian females, because the blinds can be put down and they can remove their hijab. So that's a really good thing to do, and just to invite you to work with Bennett's End Active in anything you're doing around the ward of Bennett's End. So thank you.
And the members, Helen, who Councillor Hannah just mentioned, is the Health and Equalities Officer referred to. So, and you'll see from the report that she's been doing some work also to try and facilitate and aid swimming as well, because there are barriers to swimming for women of certain parts of the community. So,
Another question, just to give you all a little update. I recently sat at Hertfordshire County Council on the obesity scrutiny committee day. It was absolutely brilliant, and we came out with some list of recommendations. I don't know, have you seen it?
I haven't seen it.
Okay. It's I'm sure I'll be able to share with you the sort of report at the end of that. So if you like, I can send it to you or send it to Jenny and get it out to everybody. But it was a really good day. We heard from, for those of you who've never seen a Herts County Council scrutiny review, it's you spend a day getting collecting evidence, if you like, from various partners in that particular field, and we heard from all sorts of people, from not just from within the council but other partners from outside. It's also that if anyone's really interested to listen to the whole day, it's all on YouTube. I'm sure a potted version would be good enough for anybody. But they talked about the target age groups and ethnicities and cultural difficulties and things like that. It was a really, really good scrutiny that we did. So I'm happy to share that with everybody.
Thank you. Much appreciated. Thank you.
Thank you. Thank you very much. I noticed the heading Bikes Without Barriers. And one barrier that I've come across for biking is a lack of places to park them at the neighbourhood shops and things like that. It seems that it might be quite a good idea to have a really spanky new bike, great big bike racks. Be very useful. I personally would find that very useful, but I think it might be useful for people who might be inclined to cycle.
You need to cycle down to Nash Mills. We've had them all put in the Deans.
I will do.
Thank you. Okay, so now we'll move on to domestic abuse. So we've got a presentation. We haven't actually given Jodie an opportunity to introduce herself. So if you'd like to introduce yourself.
Yes, of course, and thank you for having me. I'm Jodie. I am Domestic Abuse Project Officer, and my role broadly encompasses trying to improve our organisational response to domestic abuse, so reviewing policies, procedures, practices, trying to get everything as strong as possible and feeding into an accreditation process that we're working towards with the Domestic Abuse Housing Alliance. So the Domestic Abuse Housing Alliance are a body made up of Standing Together Against Domestic Abuse, the National Domestic Abuse Organisation, and a number of housing associations, and it's designed to be a sort of housing-centric focus of providing the best level of care and response for victims and survivors of domestic abuse. So that's broadly what my role encompasses. It's nice to see so many familiar faces that I've seen in some of my other sessions before, so thank you for having me today. I do have a presentation. It's not the most exciting presentation in the world though, so I figured that given you're all here, I will just kind of chat through it instead. So just in terms of context setting, obviously, when we're talking about domestic abuse and referring to the definition as given by the Domestic Abuse Act 2021, which broadly includes that domestic abuse is physical or sexual abuse, violent or threatening behaviour, controlling or coercive behaviour, financial or economic abuse, or psychological or emotional abuse, or any kind of combination of those types of abuse. It encompasses those who are aged 16 and over and considered personally connected, so whereby family connection, intimate partner relationship, any of those sorts of settings. Unfortunately, seeing an increase in child-to-parent abuse as well, particularly as, you know, naturally a lot of people are staying at home longer as well, and you've sometimes got adult children living at home with their parents for longer. So those numbers are starting to increase in that way. Any abuse that is enacted on anybody 16 and under is still considered child abuse, but children are recognised within the Act for the first time as victims in their own right if they see or hear the effects of that abuse. So in terms of the kind of proportion, we know that domestic abuse affects as many as 1 in 6 people and as many as 1 in 4 women across a lifetime. So the statistics really, they are staggering. I have to give a little bit of a trigger warning because a lot of the things I have to talk about today are really not that heartening. They are a little bit depressing in places, but very important to talk about within the context of health. So Diane had asked me to really talk about those intersections between domestic abuse within a health setting. So I've chosen to focus on the kind of aspects of physical health and then of course on sort of mental health as well. And at the end of my slides, I've got some information about how to access or signpost support, which might be of interest to you, your constituents. So I will share that with Jenny afterwards, so you've got that information. So,
Jodie, sorry, I could just interrupt you. Are you able to share the slides at all, or is it?
I can, if it's not going to interrupt with that.
Yeah, or join the Teams call perhaps. So if you're able to share with members, I'm sure the committee would really welcome that.
I was going to interrupt your Teams call to do that.
Not sure that was. Oh, sorry.
That's fine. There we are. I was in here earlier today. It's remembered me. Okay, wonderful. So, I'm going to display mode for you. Wonderful. Okay. So when we think of domestic abuse and how it links to physical health, it's likely that we would think of the most physical aspects of abuse. So things like hitting, punching, other acts of sort of physical violence. And perhaps we might even think of physical acts like sexual violence. So we know that in up to 30% of rape cases, they actually occur within a domestic abuse setting, and that's something we really kind of need to keep front and centre in those links. Within this, of course, it's important to be mindful that many aspects of domestic abuse may not be visible immediately or known to us in this way. With that being said, though, I wanted to just talk a little bit about the impact on physical health. So 1 in 5 high-risk victims reported attending A&E as a result of their injuries in the year before getting effective help, as well as short-term injuries. Victims of abuse suffer long-term physical health consequences. Health conditions associated with abuse include asthma, bladder and kidney infections, cardiovascular disease, fibromyalgia, chronic pain syndrome, central nervous system disorders, gastrointestinal disorders, migraines and headaches. Domestic abuse also often leaves victims with reproductive consequences too, probably because of those links with sexual violence as well, including gynecological disorders, sexually transmitted infections, preterm difficulties and pregnancy difficulties. And at least a fifth, 18% of children in domestic abuse households are injured as a result of the abuse. So they're pretty staggering, these statistics. I do apologise. But we cannot, of course, ignore the most severe physical threat. And when I really was thinking about health, I thought, well, what's the opposite of health, right? The loss of life. That is really the most binary form of it, the loss of life. So unfortunately, we continue to be the area with the highest number of domestic homicide reviews in Hertfordshire. Yes. Yes, a figure that is definitely disappointing to me too. So when I asked for some data on this earlier this week from Hertfordshire County Council, there were 8 in the period between 2012 to 2021. Of these, all the perpetrators were male and the victims were female in all but one of these instances. In 5 of these cases, the circumstances were intimate partner violence. So really it does drive it home in terms of, it brings it very local, obviously, in terms of the really severe extreme end of the outcomes of domestic abuse in that way. But also given that, you will represent your different wards, I thought it might also be interesting to know that in the last data I reviewed of police reported instances, Hemel Hempstead Town Ward came up again for I think the 3rd time in a row as the highest area of police reported domestic abuse instances. I think when you consider it in light of where it is, you have a high number of sort of multiple occupancy properties, a high congregation of people in kind of one area. It's not necessarily surprising in that way, but it is still quite startling when you consider that. And then when we consider the other side of sort of domestic homicides, as they're often referred to, we also have to consider the growing research around domestic abuse and suicide. So within the research around domestic homicide reviews, traditionally that wouldn't have allowed space to consider suicides that were as a result of domestic abuse, but that is broadening. And I think actually just this week or last, they're looking at extending the term of how that's looked into. Can't remember off the top of my head what they've decided on, but they're basically looking to increase the scope so that where that has occurred and they can see that domestic abuse was in that context or a factor in that, they can consider it within the broad picture. So it's estimated that 1 in 8 women take their own lives as a result of domestic abuse, and every day almost 30 women attempt suicide as a result of experiencing domestic abuse. Every week, 3 women take their own lives, which is, again, roughly the same figure as those who are killed in kind of those physical acts of domestic abuse. So really startling. In 2020 to 21, there were over 30 domestic abuse-related suicides reported by the police, a likely underestimate as obviously only those with a history of abuse were included and where they could kind of drive those causal factors and where it was known. But the approach, like I said, is changing in terms of how they're able to review those. And some of you, if you are particularly familiar with this kind of work, you'll know about domestic homicide reviews. So they will be launched when there has been a death as a result of a domestic abuse incident. And there will be a review to see the services, the agencies that were involved, to see if there were any opportunities for intervention or escalation that have been missed and lessons learned from it. From those, I can say, having reviewed quite a few, far and away, the outcomes usually say that there were pockets of information that were not being shared. It was that, certain agencies had one bit of the picture, another agency had another, and we weren't doing our sort of due diligence and sharing that information proportionately and lawfully as well. So that is in terms of the, let's have a look. Yes, the physical health side of things. And I wanted to talk a little bit as well around the mental health side of things. So obviously there are some overlaps within this, and that, you have the physical consequences, but there's likely to be mental health consequences too. So over 50% of high risk victims reported having mental health issues. I think when you consider the context of this behaviour that people are being subjected to, it's not surprising that it would be traumatic, right? And that would have long-lasting effects on your mental health, your sense of self-esteem, your trust in other people, and all of those sorts of things. And we know now, in terms of sort of trauma-informed responses, of understanding now a little bit more in terms of why people might display certain behaviours, that it's actually as a result of their trauma and not perhaps as sort of a pathological mental health condition or disorder, so to speak. 7% of victims reported that they considered or attempted suicide as a result of the abuse, and 17% reported self-harming. But it also has significant psychological consequences for victims, including anxiety, depression, suicidal behaviour, low self-esteem, inability to trust others, flashbacks, PTSD, sleep disturbances, and emotional attachment. Between 30 and 60% of psychiatric inpatients have experienced severe domestic abuse. So I think we really have to look at kind of those intersections of, we know that the mental health services, of course, they're overwhelmed, we know this, but it's in terms of recognising where actually there are perhaps other models of support that people can benefit from as well, and kind of those community groups that we have where people can kind of share experiences within a safe space. But also the need to not necessarily medicalise all the time. There's a whole raft of things that can be available for people. And given that children are included, I just wanted to briefly mention them within this. So I've said, of course, that within the Domestic Abuse Act, children have been recognised a little bit more for the first time, which is fantastic. But I think we still have work to do in terms of actually how that is recognised in process and how actually we make those distinctions with giving appropriate support and care to children as well. There still are a very, very low number of children-centric support services, and we still have some way to go in that arena. Safe Lives Insights reveals that 2 in 5 children, so 41%, in families where there is domestic abuse, have been living with that abuse since they were born, which is pretty horrible. So many studies from this, and I'm reluctant to draw too heavily on some of these because it would take way longer than I've got here today with you. But there have been, studies that have suggested kind of impacts with developmental issues, the trauma, trust, attachment, all of those sorts of things. And of course, we have to also recognise that if somebody is growing up without a healthy model of what a relationship is, it's unlikely that they will come out of that unscathed without some kind of impact on what their idea of what healthy relationship or family setting is. If anybody is interested particularly in the impact of that, I would highly recommend Dr. Emma Katz. She's done some fantastic work, particularly on the impact of coercive control and the impact on mothers and children. I've had the pleasure of being on a webinar that she was in, and she is fantastic. She's done some brilliant work in this field, particularly a lot of stuff around sort of family courts and tracking journeys of families over time. Children exposed to domestic violence may show declined educational performance and social abilities, internalisation problems, depression, post-traumatic stress disorders, and externalisation symptoms such as aggressive behaviours and even lower levels of IQ. Of course, this isn't a broad brush. It's not saying that everybody is going to experience those things or that these children or these people in any way should be written off. That's absolutely not what I'm trying to say. It's just being aware of kind of that cumulative trauma and really considering that within with the health and the well-being of our people. So what are we doing? What are we doing to respond to this? So I can say in terms of my role, so like I said, I am responsible for leading the Domestic Abuse Housing Alliance accreditation process. That is a framework of 8 priority areas, which ranges from sort of your policies and procedures on one side through perpetrator accountability, publicity and awareness raising, lots of different things that have actions within them. And that's broadly what we're working towards. We are estimating, hopefully, to be completing that within the year. So some of the most recent kind of successes are looking into further training around the impacts of domestic abuse. We recognise as well that, of course, we are a housing provider as well as a local authority. And one thing that the DAHA model is fantastic at is really recognising those links in housing specific issues. So for a lot of people experiencing domestic abuse, they are likely to also have housing needs in the sense that they may be homeless as a result, they may need to flee, they may need access to benefits, they are likely to come into contact with our services in one way or another. So we really have that unique position of trust. And also we go in people's homes a lot of the time, you know, we see we're privy to a lot of things a lot of the time. So we're really trying to get to a place where all of our employees are absolutely aware of the impact of domestic abuse and what they can do personally to try and offer support and to escalate those risks where possible. We're also as well, of course, committed to the meme approach, which I have to admit, I think Natasha is much more involved in than I am in terms of this, but I just wanted to mention it. So that's the Making Every Adult Matter approach, which focuses on ensuring that people facing multiple disadvantage and experiencing combination of problems, including homelessness, substance abuse, and contact the criminal justice system and mental health services are also supported, and that's very much woven into the accreditations. There is a whole section on intersectionality and anti-racist practice, and how do you actually look at your community and see what they need, who are your people, who are your demographics, what are their unique needs, and how do their circumstances impact what type of support we need to offer them. We also as well regularly attend MARAC, so the Multi-Agency Risk Assessment Conference. Our local one is held in St Albans. It's held every other Tuesday, and what we have done is we have set up a proactive group called the Domestic Abuse Action Group that meets the Wednesday following this. And what will happen is all of those high risk actions will be identified there for our constituents, our people within Dacorum, and we will look for ways to support them further and work with our partner agencies as well. And in terms of employees, so Councillor McCarthy, sorry, I can't read very well from over here. So we were talking just briefly about the employee support. So we launched our first standalone employee domestic abuse policy. Previously, it was included within our overarching one. And what we have done and what I've been working on as part of that is a workplace support plan, which broadly follows what a specialist service would use as a safety plan. So it talks about options to, if an employee makes a disclosure, how can we support them in the workplace? How can we make sure that they have access to additional leave if they need it? That we can support them with accessing emergency accommodation funds, those sorts of things. But just generally, how can we keep them safe when they're with us here? That is currently being rolled out to every single manager from lead officer level and above. I think at last count I was at about 150. So firmly on track to get everyone. And the idea behind that was to give employees the ultimate amount of choice, ultimate amount of agency, that they could go to absolutely any manager within the organisation and tell them if they needed support. There is, of course, as well the domestic abuse policy for residents and tenants, which is on our website. And I'm going to take a breath. I think that's pretty much everything I had to share with you today. The last slide is just on support services. So I will share this. I just wanted to highlight, we obviously have many services offering in the Dacorum and Hertfordshire area. So these are three of our kind of most prominent within our Herts County pathways. The newer one, which you may not have seen before, is Beacon. Beacon were newly announced as kind of anyone can enter at any risk level, and they are at the top, so they will risk assess and they will work out what person or what support service somebody needs to be supported by. We're also fortunate enough to have an outreach worker who works with us on a Wednesday, and she's available on site as well to pick up any queries that come up that way. And we've also got Herts Adver for high risk victims as well. So I will share those after the session today, but thank you very much. Okay.
Thank you very much. And just to add also as well, Hertfordshire's got a domestic abuse helpline, which has, it's kind of a one-stop place for any issues relating to domestic abuse. If you're working with someone who makes a disclosure but doesn't have any idea where to go, that's quite a good sort of one-stop area to go. And if any members want specific training on domestic abuse, the Herts Safeguarding Adults Board and Safeguarding Children's Partnership have free training available. So if it's something anyone's interested in, you can book online. So I'll move on to Questions?
Can I, thank you, Chair, if I may. Is there any way that we can combine what Councillor McAreevy's just said with your excellent slides?
Yeah.
So that we can have it all in one place?
Yeah, so Heart Sunflower will, that's what she's mentioned is sort of the overarching, but I can pop their details on there as well.
Councillor, whose hand went up first? So many hands went up there.
I don't mind.
Councillor Madden.
Hi, I'm interested to talk to you about domestic abuse. Everybody assumes it's always women. And I've actually, in the past, I've refused to be involved with this white ribbon thing that all the councillors have been involved with, because I have, not immediate family, but I have a family member who was a man who was very, very, very seriously, mentally, emotionally and physically abused by a woman, with disastrous consequences. And it's never talked about. And I just want to know what you can tell me about where we are with that. So what the statistics are, because I think a lot of men don't come forward.
Yeah,
because they're embarrassed.
I think you're absolutely right. I think we're still in a place where, the statistics are weighted at roughly, I would say, an estimate about 75-25, right?
That's what I've read.
They're roughly kind of weighted at that. But I think that with anything like this, the true extent is never really known, because a lot of people are still not disclosing or feeling comfortable to, for a lot of reasons. And that's entirely their decision discretion to do so. We need to make sure that we're making sure that they know that our support is out there, that if they want to access it, they can. I think so. All of the services I've mentioned here are open to any victim, any sex, any gender. I don't include any that are specifically targeted to just cater for females. You notice in St Albans and Herts, we're Women's Refuge. In the name it says Women's Refuge, but actually as a service they're open to male victims as well. Okay. It's just that they have a women's only refuge space as part of that model. But all of these services here are open to male and female victims and anybody else who wants to refer or be referred into it. I think there are definitely things that can be done to raise the profile, obviously, around making sure that we know that everybody feels welcome within that model, and that if they feel they can self-identify. There's some really good information. I will try and grab his name, I can't remember off the top of my head, but he did a really good presentation actually with Daha, where he was talking about male victims and some of the things actually and the challenges that they had to get past. And he talked about something called the man box, this idea of what masculinity is, this idea that then prevents men from feeling like they can come forward because they feel further stigmatised, that actually they feel weak and they feel like this shouldn't happen to them, and that they are in a minority of those numbers, which means they don't feel like they can identify with it. They don't feel like there's services available to them. There are also as well, which I can pop in here, there's Men's Advice Line, which is just for men. You've also got Respect, which deals primarily with men as well. And you do have male IDVAs as well, available within the IDVA service. So if somebody did feel more comfortable disclosing as a man to a man, they can do through those services, and they would be accommodated in that way. But all of the work through Daha is about every victim. It's not about discriminating by sex or making those judgments. But it's just worth, I guess, saying I can't falsify the statistics. Obviously, they tell us what they tell us. But it's kind of recognising that there's a space for everybody to be within that. And I don't know if you've seen, actually, there was a really fantastic documentary, it's on BBC iPlayer still, about Alex Skeel, which is a really, really fantastic look and a great police response, actually, from how they got this young male victim, very, very local within Bedfordshire. They got him into support, and it was by continual kind of engaging. It's called Abused by My Girlfriend. It's on BBC iPlayer. It's harrowing. I'm not gonna say that it isn't, but they talk quite a lot about the particular challenges they had there as well, because he, wasn't aware that that was what was happening to him. It was, I think, his first sort of serious relationship, and the kind of tools and the behaviours are broadly the same, but what we do see is different patterns in terms of how that violence is enacted. So you tend to find an increase where it is a male victim, actually, in the use of weapons, because taking into account the sort of physical strength differences, you might be more likely to see I heard of cases, where high heels were used. You've got burning, scalding, those sorts of things that you might just be different patterns of the same kind of arena of behaviour. But absolutely, everybody's included within this model.
Thank you. Can I just congratulate you as well, because I was listening to your presentation and I was waiting for you to say women I was very conscious that you didn't, and I want to thank you for that, because I think it's something that we don't talk about enough, and in every other part of society we talk about, we try and push up the ethnic groups, community groups, this and that, but this is something that is all sort of shoved under the table, and that's why this action thing against abuse against women and children that the council has supported and had their photos taken in the chamber over the years, I won't do, because if it's 1 in 4, that's a lot of people. That's a lot of people. So thank you.
Thank you.
Thank you. Yeah, good question, Jan. And kind of on the back of that, I did notice that you mentioned young people growing up with abuse, just like, really I'm curious, I think, you mentioned it this evening, that we all kind of have a stereotypical idea of what it means. My concern is children. And I just wondered if that comes under, and specifically in the past few years, it's very difficult to go anywhere. I was going to say Dacorum, but actually I'll just say anywhere without the smell of cannabis.
Yeah.
And I don't think I'm alone around this table to have witnessed parents walking children home from school with a blooming joint in their mouth. And you feel so helpless. You feel so helpless. And to me, that's just bordering on sheer irresponsible evil. I just don't think it's at all. And it's a relatively recent phenomenon, I first witnessed it at Jarman Park. I was delighted when it suddenly became very family orientated. What a change. But cast your mind back, people, when that change happened, and I remember walking past there, and there were a couple of parents just sitting outside on the chairs with their beers, with their kids, just smoking cannabis, and it's like, seriously, so my question revolves around that, care of children, and basically child abuse come under what you've discussed.
So it would come, so domestic abuse, of course, falls under the sort of safeguarding umbrella, right? It's an element of safeguarding. If it's more connected to sort of something on domestic abuse related per se, but related to children, I would recommend going through sort of our safeguarding channels. We've got Sue Warren, who's our safeguarding lead. She's fantastic. She also comes from a police background, so she has lots of that kind of perspective. So I think if it's obviously within the context of a child within a household where there's domestic abuse, but then there's also drug use as well, then there are kind of safeguarding channels that could be escalated through. But in terms of more of the drug use, it's hard, isn't it, when you see somebody out, because you don't necessarily know where they live or where you can take that particular kind of concern. I say from experience, it's very prevalent even where I live. I smell it all the time. There's lots of people in sort of flats near where I am with children and things like that. I think you're limited in terms of knowing where to take it unless you've got an exact location and you know that person, those sorts of things. But the police are, they are there. You could always report it.
Yeah, can I follow up, Chair, please?
Yeah.
We did have an issue locally a couple of years ago, and myself and my colleagues, we managed to get DVC to issue diary sheets to neighbours and so forth, and the dope smoker was indeed called in. And I think, because it's something I'm quite keen on trying to resolve. So, you know, I've looked at various channels, and I think the first one you sort of, you know, you go to is, you know, enforcement and the police. And I just want to say that it's been incredibly difficult, and there doesn't seem to be any facility within DBC apart from the antisocial thing, you know. Smoking dope in your own house is okay.
Well, it's
But I have to say, and it might be useful for others around this table and colleagues, but the situation we had a couple of years ago, which I just talked about, that was not a council tenant. It was not a shared household tenant. It was a privately owned house, and we kicked up a real stink, and we managed to get it sorted. And I quite honestly, obviously the guy didn't give up smoking dope, he just went somewhere else, you know. So it can be done. But as I said, my concern is for younger children. And I just think that, you know, the police couldn't do anything, and, you know.
It might be worth us, because obviously Jodie's here about domestic abuse specifically.
Yeah.
So it might be worth adding to the work plan something around drug use, because they are obviously potentially coexisting, but yeah, it's going off on a tangent, and I don't think it's fair on Jodie to answer. So
I may not be the best. I may not be the best person. I would probably recommend Sue Warren or Amy Dalton. Tenancy enforcement side there. They would be able to really flesh that out.
We can add that potentially to a future work plan for sort of future discussion, but we need to sort of be moving on. So, Councillor Pringle, did you have a question?
Yes, I do. First of all, thank you. I really appreciate your presentation. You know, and how much we're actually doing in this area. However, it remains shockingly disappointing that we are the highest area for domestic abuse homicides. And I think, you know, whatever else we talk about, that is what we have to actually reflect on as councillors. What can we do? We are the public representatives where there is the highest homicide area in Hertfordshire. You mentioned something about the breakdown of that. So, and you said there were 8, was it during?
8 between 2012 to 2021, which is the most recent data I have.
And what proportion of those were adult women?
They were, I believe, I think they were all women but one. So seven
was
women.
The one who was male, was that an intimate relationship with a woman?
I can double check it for you on the data.
It'd be interesting to know, because the reason that the government uses the term violence against women and girls is the policies apply to everyone, including men. And the reason it's discussed in that way is because statistically, it's hugely the most serious physical violence and coercive controlling behaviour is male violence against women and girls, and hence shown by the fatality statistics. But it is appreciated that men can be victims too, and obviously will present in different ways. And in that respect, the two things I'm interested in that are likely, because we have to think, hang on a minute, how can we actually make a difference? We all, as a society and as a community, have a duty to recognise this in our society. And, you know, child abuse is something which we're all very concerned about, but the cost, apart from to individual women's lives, people losing their lives, being traumatised and injured for the rest of their life, is also a cost to the rest of us, because it comes out in antisocial behaviour and in educational underachievement and in future crime. It's very, very common that children who are involved in antisocial behaviour and crime are actually themselves victims of abuse and domestic abuse. And we need to see all of these things in a wider context and look at what we can do to prevent rather than to necessarily judge people. And so the two things that I think would be really useful to know about is, first of all, MARAC. What is our MARAC? You know, maybe we can look into it and you can come back at a future time, because I would like to know, is our MARAC referral rate this similar to other areas with lower domestic abuse in the country, or are we not referring enough cases to MARAC?
I would probably recommend Sue Warren. She's our MARAC representative, so she would be able to give you all of the details.
So if you could, you know, maybe on a future report, just get the you know, report back to us on that. And the other thing is, I had the privilege of watching a presentation by an experienced IDFA very recently, and what they can do is enormous, because women as well, like men, often don't see that they're a victim of abuse, particularly when it's coercive and controlling behaviour. And women will experience violence and abuse many, many times before they report it. And quite often it's only reported because they're in fear of their life. They wouldn't report it normally, but they become so terrified that that's how it gets reported, or a neighbour intervenes, or a third party. And what I find is often, even in the most, you know, people don't look at the overarching thing because it's seen as one incident, then another incident, then another incident, rather than a pattern of abuse that may be stalking, harassment, or coercive and controlling behaviour. And one of the most useful things for turning that round is the intervention of a good IDFA. And what I notice is that there are different cultural attitudes. So in some people of certain backgrounds, they come from countries where domestic abuse is seen as almost the norm. They don't have the same progressive attitudes, and it's expected, you know, something a bit like we were 50 years ago. And so they don't report, and they don't recognise that people can help them. And I'm wondering if there are other routes into IDFA help, rather than via the criminal justice system, because once someone is helped by an IDFA and understands what's available to them, for example, that they can get a restraining order, which a lot of people don't understand, and they end up going down the family court route when they should be going down the, if that was explained to them by IDFAs, and if we had IDFAs who were specialised in working with different communities, such as the Asian community, the Polish community, for example, then that would be really helpful. Is there any way we can enhance IDFA service or refer directly from housing, from things that come to us?
There's much more of a push within the DAHA model to be making more referrals to MARAC, and that's something that they are very firm on. What we need to get in place first is obviously the adequate training to make sure everybody knows how to identify it first, because we want to make sure they're identifying and reporting the right way. But they are definitely adamant that we should be making more referrals through to MARAC as housing professionals. So MARAC is open to professionals. You don't have to be from sort of a police or like an enforcement background to make a referral through to MARAC in that way. And housing is very well positioned to make those referrals, and they can do so on professional judgment. As I've mentioned as well, we do have Donna, who previously worked as an IDFA, now works with sort of standard medium risk clients as an outreach worker. And the relationship that they will have with the IDFA service as well is that if somebody came in through her, so say through us to Donna, and she identified them as high risk, she would refer to IDFA. It would make the engagement that way. The Beacon service as well, which I mentioned, they are designed to risk assess, to work out what that client's level of risk is at that time, and then to refer through appropriately. So that would be either IDFA or that would be a standard medium risk service. Beacon, St Albans and Herts, any of those other services, they're designed to be a network in that way. But the really important part obviously is to assess that level of risk and respond accordingly. And quite often obviously what will happen is that if somebody's with an IDFA, the IDFA, as they do fantastically, brings the risk down. They might then go down to a standard level and be supported by somebody else, and they would manage that transition between services. But yes, absolutely, I would really like to see a push on us making more referrals into MARAC through sort of professional curiosity or noticing those things when we are coming across it, and that's all very much part of this model.
Can I just add something as well, just as you were talking about the IDFAs? So within Hertfordshire, the acute hospitals do have their own health IDVAs and ISVAs, which are sexual violence advisors, and CHISVAs, which are children's sexual. So just to be aware, if anyone accesses any of the acute health trusts in Hertfordshire, that is services there as well. I'm going to have to move on. I think there was another.
Just had a follow-up, if you don't mind. Sorry.
Yeah, very brief.
It is very brief. I think it is incumbent upon us to actually have more public education on this, because schools, other parents, neighbours, they're the people that can obviously can often make the difference. And they need to understand that if they've got noisy neighbours, it's not just keeping them awake. There's maybe someone at risk. And so, that we need to work on some sort of public education.
Thank you. Thank you.
Thanks.
Councillor Gale. Sorry, Councillor Gale had his hand up first.
Oh, sorry. Go ahead.
Thank you. You mentioned, thank you very much for that. Very informative, very interesting. It's not my area at all, but I don't know. But you mentioned two areas in which Hemel Hempstead was the top or the worst. I wonder if you might be able to give some idea of distribution on that. I mean, someone's got to be worse, but is Hemel Hempstead an outlier, or what's the second worst? How close is it, and how distributed are they?
Yeah, so I get a map of local data sort of across the Hertfordshire area from the Hertfordshire Blog Partnership, and it has like a hotspot of areas. And within that, of course, Dacorum is bigger than some of the other areas within Hertfordshire, so it kind of accounts for that difference in amount of people within area. But within Dacorum, it is consistently Hemel Hempstead Town Ward for, I would say, the past 3 to 4 months or so, at least. And I think they didn't send a couple of few before that, but it's usually typically Hemel Hempstead Town Ward within Dacorum. As the highest level of incidence.
That's not quite what I'm asking. I appreciate that Dacorum has been the highest I think one of the statistics, Dacorum was the highest, and the other one, Hemel Town Centre, was the highest. But what I'm interested in is what the distribution is below the highest. So what's the second highest? How close is it behind? And are those outliers, or is it sort of pretty much the same everywhere, and Hemel just happens to be, and Dacorum just happens to be the top? There's a big difference, because someone's got to be the worst, and just because you're the worst, it's not a competition, if you see what I mean. What I'm saying, it's not a matter of competition. If we're very bad because we're miles ahead of or worse than everybody else, and obviously that is shocking. But if we're the worst of a group which is quite close together, then of course it's not brilliant, but it's not so. To me, it's a bit different, I think.
Yeah, I would have to check the comparative data on I'll check for the most recent one, but it does show kind of a hotspot map, which is within sort of colour coded of the areas of highest prominence within Hertfordshire, and it would probably illustrate that a little bit better from there.
Okay. There was another hand.
Thank you. Just to say, I did a walk last year with a Million Women Rising in London, and that was, I took my WI, and it was very, very empowering. And there were about 2,000 women walking against violence, protecting women. So it's very, very important. I agree, it's crucial to get education and to really explain that it's not acceptable, any kind of abuse to anybody, and that, really tie in with young people at school, and as a society, it's not acceptable. And just to go on your cannabis usage, alcohol also is not a suitable substance to be having with children. So it's not just cannabis. So just we all know that, but it's.
So in terms of your point, you mentioned sorry, I've lost what something really good to say, then I've lost it. In terms of what you were saying about education, young
Yes,
people, schools. So I sit on a lot of the Herts County Council strategy meetings, and it's something we have continually said is about education. It's about prevention, it's about young people, it's about getting into schools, it's about relating to them in a way that actually meets them at their level and that they find engaging and they don't feel nagged at and they feel, you know, they've got positive role models. So it is something that should be high on Hertfordshire County Council's agenda to go out across the county, not just within Dacorum. And it's definitely something I can say personally we've been pushing a lot for, because it really does need to happen. One of the things I'm working on at the moment, which I'm really hoping that will go off the ground, is something in line with the Euros that are happening this year. So unfortunately, we know that domestic abuse incidents typically spike around major sporting events. So we are really trying to work on getting out to local football clubs to make sure that we have connections there as sort of positive allies, positive role models to talk about domestic abuse, and also to just kind of raise the awareness ahead of that, so we can hopefully, at least if we can't drive down the numbers, we can get people to support during that time as well.
Thank you. Councillor England, did you have a question?
Yes, it might have popped out of my head now, but I think what I wanted to ask, yes, is there anything about, is there any reason to suspect that there is anything about the type of housing, the configuration of housing, which makes, which correlates with domestic abuse?
Good question. So by type of housing, what do you mean, as in like flat house or social housing, private, rented, that sort of thing?
Density, configuration.
Not that I know of. It's a good question, but I haven't seen anything around sort of research in that area. I think, you know, when I talked about Hemel Hempstead Town Ward, I did think about the layout in terms of you've got lots of flats, you've got lots of sort of multiple occupancy buildings around that area. So does that drive up the numbers because there's just more people within a smaller part of that ward? But I don't know if there's anything specifically around the kind of trends around that date in that area.
I suppose one of the problems we've got is that some data points are quite small numbers eventually, even though they're horrendous numbers, they're smallish. And what you're then perhaps looking for is, you know, just as we saw in the last few days, that if you're somebody who causes harm to animals, apparently is more likely to cause harm to human beings. So if you can identify a large data set, then you're getting closer to, you know, spotting the people who are going to commit the murders.
Absolutely.
And I was wondering if there was any way of vectoring the data.
Yeah, I think I would hope that would be something from a police side that they would be looking into in terms of the prevention work, but I don't know. Locally, I do think though, when I will share that map with you, because obviously these are all your wards, so it's quite helpful to know the makeup of those instances and that.
Thank you. The data comes from a number of sources, which I just happen to be aware of because it's something I've been involved with elsewhere. I would encourage, if members felt that it would be helpful to actually have a formal training session with much more detail where we can discuss because obviously this is the context of a meeting, so we have a limited time. Would members like us to arrange a formal session for all councillors, not just within health, around domestic abuse? Is that something? Yeah, okay, we'll have a chat about arranging maybe a half-day session or something for all members. Sorry. No, have you got another question? We're going to have to
very quick on
Thank
the
you.
methods in which we uncover domestic abuse and violence, and I was wondering if there's anything specific to this area which makes it slightly more obvious what's going on than maybe somewhere else.
I guess if you're thinking about a person, you know, changes in behaviour, it depends, of course, on how well you know that person to know what changes are. If you are somebody being increasingly withdrawn, isolated, those sorts of things. it might be in terms of property, obviously we go into properties, it might be unexplained holes in the wall, damage to property, those sorts of things, which we're trying to kind of increase awareness of in that way. You've got things which were mentioned, sort of noise complaints, recognising that actually what might be misconstrued as antisocial behaviour is actually domestic abuse, and that needs to be reported and sort of looked at within that context. There's lots of guidance. Do you have access to Dennis?
We do, but I think it would be helpful to arrange it because there's so much interest in it, and I think as well, not just the ones sitting on health. I think a lot of the members across the parties would probably benefit from that. So we'll have a chat and arrange something.
Thank you so much for being so engaged. Enjoy.
Thank you. Okay, so we'll move on to item 10, which is the County Council Health Scrutiny Committee report. I'm not sure if anyone has attended the County Council Health Scrutiny meeting.
I had to send my apologies to the one that I think Jan was at. Are you? No?
Okay.
For many years, I've been the deputy, supposed to be the deputy, which means that whoever is the main person, if they can't go, they're supposed to let me know,
Right.
so that I will go.
Okay.
But I obviously won't go, and there's no point in me just sitting and watching it unless I can be involved and vote. So I would only go as a substitute if the first person can't go. I don't know who the representative is anymore.
It's me at the moment, but I wasn't invited to the last one because they didn't have me on their mailing list for. I thought they were supposed to be notified that I was, but.
That's the first thing. Has that been corrected?
We'll have to get
Yeah.
if you could follow that up and get that corrected. And yeah, we need to get this sorted so we can have updates and we can have minutes when we're here, because at the moment we don't have the County Council Health Scrutiny report, and we also don't seem to have a representation for the adult care services unless anyone knows different. So this is something we need to establish and follow up. So I'll find out about the adult care services as well, who that is, and we'll follow that up and update at the next meeting. And so we'll move on to the work programme. I don't propose to go through it in detail. I'll take it as read, but if there's any specific questions on it, could you let us know?
Chair, I don't know if there's going to be an update on the progress or otherwise of the health campus. Not saying today, I wasn't expecting it today, but I mean, at the next health committee and subsequent health committees, is there going to be updates?
So the intention will be to have quarterly reports, unless there's anything in addition that is, because what we don't want is every meeting to be focused on that. So the intention is we'll do quarterly reports unless there is something particularly imminent that we need to discuss. Does that make sense to everybody? Okay. Thank you.
Chair, sorry if I may, just on that point, given the complexity of that project and the likely length of it, those quarterly reports may of course just be verbal, because between one quarter and the next there might not be significant progress just by the nature of the type of work and development. So just they might not necessarily be full written reports every quarter.
Any other business? Okay, thank you.
Thank you.
Need to close.
Thanks.